White House Coronavirus Task Force met today, and despite the fact that there have been more than 843,000 Americans who contracted the coronavirus, and we grieve the loss of more than 47,000 of our countrymen. According to Dr. Birx and her team, we continue to see encouraging signs because the American people have been putting into practice the guidance that's been issued by the President and this task force, and they've been taking to heart the guidance of state and local officials. Mr. President, as we learned today, we are continuing to see declines in all the major metro areas around the country that have been most impacted. Numbers remain low and steady on the West Coast, in Washington State and in California. The New York metro area, New Jersey, Connecticut, all appear to be past their peak. And as our scientists may reflect in a few moments, we also are seeing the positive rate going down, which is actually even as encouraging as the declining cases. The Detroit metro area appears to be past its peak. The Seattle metro area, as I mentioned, remains stable. New Orleans metro area is the most stable of all the large metro outbreaks. We also are continuing to see stabilization and even declines in Houston and Atlanta and Nashville and Baltimore and Indianapolis and elsewhere. This is a tribute to the American people, to the fact that the American people have taken to heart the guidelines, the social distancing, the personal hygiene, the recommendation that you use the drive-through at a restaurant rather than going in a restaurant and avoiding groups of more than 10. On the President's behalf, on behalf of our entire White House Coronavirus Task Force, we just want to urge all of the American people to continue onward. We all want to reopen America, and we want to reopen our states and our communities as soon as it is safe and responsible to do so. But I want to say to my countrymen, the fastest way to reopen America is to continue to do what you've been doing. It's the fastest way, as President Trump has said many times, to get our country working again is to put the coronavirus in the past. And we are on our way to doing just that. You know, for early on, the President called forth not only the full power of the federal government, but he called forth the full weight of the American economy. And I had the privilege yesterday to travel to Madison, Wisconsin, and see American industry and American workers at their very best. And I want to thank the GE healthcare team in Wisconsin, as well as the union machinists that I spent time with all day yesterday. It was extraordinary. Mr. President, earlier this month, you used the Defense Production Act to ensure that supplies could flow to GE and General Motors and Ford and other companies that were prepared to repurpose manufacturing lines and hire new workers to construct ventilators. And at this particular plant, they literally have, the union sat down, the machinist union sat down, and in less than 1 week negotiated a new contract with GE Healthcare that allowed them to begin to bring in workers from around the country. They doubled their work line in 1 week. They're about to triple it. They've been going 24 hours a day, 3 shifts, 7 days a week. And then the President promised that by harnessing the power of the American economy, we would have 100,000 ventilators in 100 days. But thanks to the ingenuity and the hardworking Americans that I was with yesterday and other companies, we're actually going to have 110,000 ventilators in 100 days. They were all wearing T-shirts, Mr. President. I brought one back for you that simply read, "Union Machinists Save Lives." And to that great team at GE Healthcare, I want to just say all of America is proud of you and grateful for you. We're also grateful to all of our healthcare workers at every level and all the work that they're doing. And we're proud that our National Guard and our American military are at their side. As our task force learned today, more than 31,000 National Guard have been stood up around the country. And the President, in the last day, extended what's called Title 32 authorizations for all National Guard personnel through May 31. So we're going to continue to partner with states as the National Guard plays a vital role in testing and in cleaning nursing homes and in standing up states' response. Military personnel, Mr. President, we have more than 5,500 active duty military personnel including, as of yesterday, 964 medical professionals in the uniform of the United States working in 17 hospitals in 7 states around the country. We're also very proud of our team at the VA. The VA has addressed its capacity issues. It's not seen cases among the veterans in its facilities increase, so they're deploying teams to focus on nursing homes. In Massachusetts, the VA personnel have disinfected 2 different nursing homes. In New Jersey, they literally taken over 2 state nursing homes and deployed 90 doctors and nurses. And in Florida, we're sending 16 teams to assist in nursing home operations. As the President also mentioned, in addition to what I saw yesterday in Madison, Wisconsin, we continue to build our strategic national stockpile. It's growing again with ventilators, on nearly 11,000 in supply. 901 new ventilators will be added, transitioned in the near term, and every American, I think, can be confident that should the need arise for your family member facing serious consequences from the coronavirus to need that equipment to help them breathe, that equipment will be there. As we said yesterday in Wisconsin, and you've said, Mr. President, I think it should be a great source of comfort to every American that no American who has required a ventilator in the United States has been denied a ventilator. And that's a testament to our healthcare workers, a testament to every American putting mitigation principles into practice, and it's a testament to all these great companies. Speaking of great companies, American businesses are stepping up. It was on April 1st that I traveled to a Walmart distribution center, and the President reached out to the President and CEO of Walmart to ask Walmart to get in the gowns business. And Mr. President, I'm glad to report to you that we heard today at the task force that Walmart is producing 8.4 million gowns, and they will be delivered into our commercial supply to healthcare facilities around the country by the end of June. They're hardly alone. Honda is producing 500,000 face shields. New Balance is making 100,000 masks a week. In a very real sense, the American people have stepped up to make the sacrifices and endure the hardship that social distancing has required. But American businesses at every size and every means have come together to respond to the President's call. It really has been a whole of America approach. And our message from the President's White House Coronavirus Task Force is to tell the American people it's working. We're getting there. We can see light at the end of the tunnel. We can see the day that we can reopen and put America back to work. But it's going to take all of us continuing to make the sacrifices necessary to practice those disciplines to get us to a place where we can reopen safely and confidently. With that, Mr. President, I'll call Dr. Fauci up for his reflections, and we'll move on.
Great. Thank you very much, Mr. Vice President. So I'm going to just take off from where I was at this podium a few days ago to kind of reiterate some of the things that the Vice President said, but to kind of connect the dots from where we were, where we are now, and where I think we're going to be. So you remember a couple of weeks ago when we talked about the fact that we were going to have a really bad week because the deaths, particularly driven by the situation in New York, were going to get worse and worse. But yet, as that was happening, we were starting to see some turnaround, some flattening, and some coming down. As you've heard from Dr. Birx and will likely hear more, that is continuing. So what has happened is that the mitigation that we put in with the first 15 days and then the 30-day mitigation program of physical distancing worked. So it got us to where we are today. It is a successful formula. It is the basis for our being able to say that we can now think seriously about reopening America. And for that reason, we put together a carefully thought out and I believe well delineated and described program for opening up America again. And you know what it is. It's the guidelines that we announced a few days ago. Those very guidelines are based on a version of the successful formula that got us to where we are. So what I'm trying to say is that the program is not one that is going to be turn the lights on in America, we've finished. We're not. We have to proceed in a very careful, measured way. And if you look at the guidelines, they are careful and they are measured. There are certain checkpoints before you can even think about going into a phase one. And then things relax a little as you go into phase two, and relax a little and you go into phase three. Now, we live in a big country, and it's heterogeneous, and there are different dynamics of outbreaks in different parts of the country. So the speed with which one can go from one to another, at the point at which you can even begin to think about the phase, is going to differ. So the one thing that I know, the urge we all have to get out there and get it over with, let's get back to normal, for a lot of good reasons, because there's a lot of suffering, economic and otherwise, in this country because of that. But again, as I've pleaded early on weeks ago, I plead with the American public, with the governors, with the mayors, for the people with responsibility. Although I know one has the need to leapfrog over things, don't do that. Do it in a measured way. This is a successful formula. The problem is, if we don't do that, there is a likelihood that we'll have a rebound. And the one way not to reopen the economy is to have a rebound that we can't take care of. So please, again, let me just close by pleading with the American public in general and those who are responsible leaders to carefully consider how we get back to normal. Thank you.
Can you talk a little bit about your expectations for the fall? We heard from Dr. Redfield and Dr. Birx. What do you see for the fall? Is it going to be embers or possibly no return of the virus at all?
You know, as I've said before here, when you look at an outbreak, it's two dynamic forces opposing each other. If you leave the virus to its own devices, it will take off if you do nothing to stop it. If you put into place the kinds of things that we talk about, first containment, and then hopefully you never get to mitigation, but containment is important. Those two forces are going to determine whether you're going to have a big outbreak. So what Dr. Redfield was saying, first of all, is that we will have coronavirus in the fall. I am convinced of that because of the degree of transmissibility that it has, the global nature. What happens with that will depend on how we're able to contain it when it occurs. And what we're saying is that in the fall, we will be much, much better prepared to do the kind of containment compared to what happened to us this winter. Now, the complicating issue is that unlike the syndromic and influenza-like observances that we have, that you could pick it up by clinically what's happening, it's going to get complicated by an influenza season. And I believe that's what Dr. Redfield was saying, that is going to be complicated. So whether or not it's going to be big or small is going to depend on our response. And that's what I think people sometimes have misunderstanding. Nobody can predict what is going to happen with an outbreak, but you can predict how you're going to respond to it. And that's really very important.
So you would caution against people thinking that in the fall there's not going to be coronavirus anymore and we won't have to worry about it. Or if it is, it'll be spotty and it won't be a big problem we have to worry about.
There will be coronavirus in the fall. If we do, which we won't, but let's take an imaginary period. We say, okay, coronavirus, forget about it. We're not going to do anything about it. It will take off. That's what viruses do. But that's not what's going to happen. We are going to respond to it to not allow it to do that.
Dr. Fauci, what happens when governors like Governor Kemp are not following this careful, measured plan and moving forward even without meeting the gating criteria?
Well,
What do you do about that?
Well, you know, if I were advising the governor, I would tell him that he should be careful. And I would advise him not to just turn the switch on and go, because there is a danger of a rebound. And I know there's the desire to move ahead quickly. That's a natural human nature desire. But going ahead and leapfrogging into phases where you should not be, I would advise him as a health official and as a physician not to do that.
Thank you, Mr. President. I really do think it's important to clarify this as we build the confidence of the American people. When I commented yesterday that there was a possibility of the fall-winter, next fall and winter, it could be more difficult, more complicated. When we had two respiratory illnesses circulating at the same time, influenza and the coronavirus 19. But I think it's really important to emphasize what I didn't say. I didn't say that this was going to be worse. I said it was going to be more complicated or more difficult and potentially complicated because we'll have flu and coronavirus circulating at the same time. I want to emphasize that we continue to build the nation's public health infrastructure to ensure that we have the capacity to stay in the containment mode. Those of you who heard me talk before, I've told you that in January and February, up to February 27, 28, this nation had 14 cases. We were in the containment mode. And then, unfortunately, the virus overwhelmed where we got into extreme mitigation. We are building that public health capacity now to make sure that we stay in the containment mode for the upcoming fall and winter season. So we will not need to resort to the kind of mitigation that we had to this spring. I have confidence that our public health response of early case recognition that we've talked about, isolation and contact tracing, combined with our plans for increased surveillance, particularly for the most vulnerable, will be an effective public health strategy so our nation will be able to maintain itself in the containment mode. And again, that will be supported by the American public's continued cooperation, obviously in the areas of personal hygiene and the types of social distancing strategies that may be appropriate. The key to my comments, and the reason that I really wanted to stress them, was to appeal to the American public to embrace the flu vaccine with confidence. One of the greatest tools we have as we go through the fall, winter season that we're into is to get the American public to embrace the influenza vaccine and thereby minimize the impact of flu to be the co-respiratory disease that we confront. Thank you very much.
Can I just
Dr.
ask a
Redfield, could I
follow-up
just
on
be
that,
clear?
Dr. Redfield, please?
Just to clarify a couple things.
But I don't know what to follow up. He was misquoted, totally misquoted. He said they could come together. They didn't talk about that. And his whole purpose in making the statement was to get a flu shot so that next fall we don't have such a big season of flu. And we possibly won't. But as you said, it's possible if the corona even comes back, and he doesn't know that it's going to, and neither do I. We spoke at great length. And I think the doctor will speak if you'd like to continue, but we may have some embers, and we're going to put them out, of corona. But we may have a big flu season. But that's different. Flu is very different from corona.
Can I ask you a follow-up question?
Yeah, go ahead, sure.
Okay, so, Dr. Redfield, the Washington Post, which you did the interview with them, they quoted you as saying there's a possibility that the assault of the virus on our nation next winter will actually be even more difficult than the one we just went through. And when I've said this to others, they've kind of put their head back. They don't understand what I mean. We're going to have the flu epidemic and the coronavirus epidemic at the same time. Is that what you said to the Washington Post?
Yeah, that's what I was trying to say to you just a minute ago, that the issue that I was talking about being more difficult, is that we're going to have two viruses circulating at the same time. This spring that we just went through, February, we had a benefit of having the flu season ended. So we could use all our flu surveillance systems to say, whoops, this is coronavirus, we need to focus. Next fall and winter, we are going to have two viruses circulating. And we're going to have to distinguish between which is flu and which is the coronavirus. And so the comment that I made, it's more difficult. Doesn't mean it's going to be more impossible. Doesn't mean it's going to be more, as some people have said, worse. It just means it's more difficult because we have to distinguish between the two. And what I was wanting to do and what I want to do again here is appeal to the American public to recognize they can really help like they did with mitigation, which they really helped. I need them to help now to best prepare us by getting the flu vaccine and taking flu out of the picture.
But excuse
He may
me.
not even have corona coming back, just so you understand. Doctor, would you like
No,
to...
but I'm sorry, but that quote that I just read was accurate, right, sir? Because that's the quote from the Washington Post. You were accurately quoted, correct?
I'm accurately quoted in the Washington Post as difficult. But the headline was
What does the headline say? What does the headline say?
Well,
Read the headline.
The headline says CDC director warns second wave of coronavirus is likely to be even more devastating. And isn't that
That's not
correct?
what he said. That's not what he said.
But if you have the two things
The
happening.
headline doesn't cover.
No, I actually think it's actually going to be, I think the American public is going to heed the request to relook at their vaccine hesitancy to vaccine with confidence for flu. And I'm confident that the public health infrastructure that we're putting together now across this country so that we can early case diagnose, isolate, and contact trace, as I say, block and tackle, that system is going to be there, and we're going to be able to contain this virus.
Why did you retweet the article if it was inaccurate? Doctor, why did you retweet it?
You weren't called.
So we talked about this yesterday when you asked me this question, and someone I think used the word devastating. And I want to really, again, emphasize to the American public that when we first interacted with this virus for the first time in the February and March timeframe, we didn't have an understanding of its transmissibility, all of its symptoms. We do now. And I think what we are building together when we talk about the public health infrastructure, it is very much working on the surveillance piece. But I think we also know the strength of the American people and their ability to immediately understand how to protect themselves with not touching their face, making sure that they're washing their hands. But the other piece I wanted to talk about, and we mentioned yesterday also, that we have this summer, while we have flu surveillance that we can utilize and syndromic management that we can utilize, we have all of that time to prepare clearly the testing algorithm that you would need in a flu potentially if COVID came back. Potentially. And so we are preparing for that potential right now. And I think we spoke to you all about that and talked about how we're not only preparing for today and tomorrow, but we're preparing for 6 months from now, 3 months from now, and making sure that all of these pieces are in place. I think what Dr. Redfield clearly is asking for, just like we ask for every American to follow the guidelines, he's saying, please add to that guidelines getting your flu shot and making sure you're
Wouldn't you say
protected.
there's a good chance that COVID will not come back?
We don't
And or
know.
if it comes back, it's in a very small confined area that we put out.
Well,
Go ahead.
the great thing is we'll be able to find it earlier this time. And I think that's what we're talking about. We'll find those cases earlier. So what Dr. Redfield said, we would be able to stay in containment phase. And what we're also hoping, and we talked about this about 4 or 5 weeks ago, that we're hoping that the flu infections also go down because people are much more aware of respiratory illnesses and how to protect themselves. We want you to get your vaccine, but we also want to also protect individuals from getting the flu because of the vulnerability we know in certain populations to flu and the devastating outcomes to flu. We could prevent and decrease both of those things. So I think we are assured that the CDC is putting in place today what we are going to need in the fall so that we can stay in containment if potentially the virus comes back.
Thank you, Mr. President. The Vice President in his remarks was talking about the federal efforts that have been undertaken as it relates to nursing facilities. And as you both know, they've been just so incredibly hard hit, just tragic, over 10,000 COVID-19 deaths so far. The industry says that they're struggling as it relates to testing. Can you commit to increasing testing at the nursing facilities
Yeah, well,
across
we're
our
doing that
country?
automatically. I mean, that's almost common sense, but we're doing that automatically. I mean, you look at the state of Washington. That was our first glimpse of it. They got hit so horribly in that nursing home. It seemed like everybody was from a particular nursing home. So we knew immediately that was going to be a problem, and we're doing that 100%. We're taking very special care of our nursing homes and our seniors, other than me. Other than me. Nobody wants to take care of me. But other than me, we're taking care of our seniors.
Another area.
please, Mike, go ahead.
Thank you, Mr. President.
No, it's just an enormously important question. And we want to thank the American people who have been putting off visits to their grandmothers and grandfathers and moms and dads. It's tough. I'm going to be in Indiana next week, and I'm not going to go see my mom. She lives in her own home, but people get it. that the risk of serious illness for a healthy American of the coronavirus is fairly low. You'll either have flu-like symptoms or no symptoms at all. But as we've said so many times at this podium, and the American people get it, a healthy American could inadvertently convey the coronavirus to a senior with an underlying health condition and have the kind of heartbreaking results that we've seen in nursing homes around the country. It's the reason why from early on, the president took decisive action to raise the infectious disease standards at every nursing home in America. He deployed all 8,000 of our inspectors, the Center for Medicare and Medicaid Services, to dedicate all of their time to ensuring compliance with those new higher standards. We've spoken about nursing home issues with governors around the country, and frankly, there are governors around the country that have done remarkable work with nursing homes. You mentioned Governor Brian Kemp. He actually used the National Guard in Georgia. He deployed them to nursing homes to do cleaning and to disinfect areas of those nursing homes, and it's tremendous service. But to your point about testing, if you look carefully at the guidelines, or Open Up America again, you will see that in phase one, the level of testing that we contemplate is first that we want to be able to test anyone who has the symptoms that may be coronavirus and be able to test them quickly. Secondly, we want to do the kind of contact tracing, and Dr. Redfield and his team are deploying CDC teams in every state in America to be able to find out everyone that that person has been in contact with and test them. But if you look right underneath that, what we're directing states to do is be prepared to deploy testing resources first and foremost to nursing homes and long-term care facilities so that we can monitor any potential outbreak of the coronavirus among the most vulnerable population. Thanks to the leadership of our Surgeon General, as the President announced today, we're also going to be deploying testing resources to vulnerable communities, to underserved communities. The CDC released new preliminary data on the impact, particularly on African American communities in this country, and it's the reason why part of our phase one recommendation is that we deploy testing resources into those communities that are described by the doctors as socially vulnerable. And even as we speak, we'll announce next week that we're already in the process of deploying testing. And so it's a good opportunity to remind every American to be especially careful around our seniors, to heed the guidance about avoiding visitations, to protect the health of those who are most vulnerable. But the American people can be assured that from phase one forward, all the way through phase three and reopening, we're going to be helping to guide the states to focus on the most vulnerable, beginning with our seniors with serious underlying health conditions.
How about you with the mask?
Yes,
I said you wear a
Mr.
mask.
President, may I actually follow up on those maps from the other day? On Monday, a reporter for a local television station in Miami sent me a question asking if it was possible to get the information on those maps distributed to the media so that local TV stations and newspapers can check on that information. So if that could be done.
Do you want to do that? Do you want to say something?
Sorry. Thank you for talking about testing and testing capacity, because we have been talking about that for several weeks, because we could see, and we did a full inventory of every single state and every single laboratory. And I also appreciate you talking about the implementation piece of the testing capacity. And it's complicated. So we have a team calling every lab and working through the American Society of Microbiology, as I mentioned before, to really work with every lab director to see what the issues are in each laboratory. And I just want to thank Administrator Verma, who really worked on increasing the funding for this test and uniquely doubling the funding for the coronavirus nucleic acid test. from $50 to $100 to really address some of the issues about laboratory technicians, because sometimes we think these tests run themselves. They don't. They actually need people to help with the machines. So we were talking about purchasing more machines. We actually need to have additional laboratory technicians to really be able to work all of those machines. And so it's lab by lab, state by state, and that's the dialogue that's going on now to unlock the full potential of the United States. Maybe the testing would not be needed at this moment, and maybe it is, but we want it also totally available in the fall if it comes to an issue where we have to distinguish between flu and COVID-19. So we're building infrastructure and capacity not only for today, but for tomorrow, and really showing a new way to really deal with pandemics and bring testing to scale, because the country has never had to do this before. I mean, if you look at some of the other countries, they're struggling with some of the issues from PPE to testing. And so this is a universal issue, but we're working on it as a collective to really have a very innovative and integrated way to approach testing.
But without building new, they have tremendous capability.
And the
And a lot-
maps are, I will ask the companies, because obviously it's proprietary where every single machine is. And, you know, if you have that machine and 5 others, maybe you don't want to know, let that person know you have 5 others. It's kind of like Coke and Pepsi. So I think we're working very deliberately to really be able to share those maps. The governors, I can tell you that all of the state governors and the mayors have those maps, and the addresses and the type of machine for every single laboratory in their jurisdiction, so that they know.
The governors were not aware that those laboratories were available to them.
Dr. Burks, before you leave, on the state of California is now partially broken with CDC restrictions on who would get guidance on who should get testing, because they want to test people without any symptoms at all in high-risk environments like a nursing home. Do you agree with this? Vice President Pence, do you agree
Well,
with this?
not only do we agree with it, it was in our guidelines. That was fundamental to our guidelines, and I think we were the first group that said testing asymptomatics will be key. We've always said that we think that's a significant contribution to infections, and we went to the places where we thought it was most critical to find cases the earliest, and so that is where we have asked states in the guidelines to start with nursing home, indigenous peoples, and people in underserved areas in cities to really ensure that we're monitoring for any type, because we know the asymptomatic piece may be the tip of the iceberg, in fact, be the iceberg underneath the surface. And so if you're only seeing cases, maybe this. But in parallel, we're working with states and local governments to really define what that population is by doing, in collaboration with states, working with them together to really reinforce this antibody testing, but in a careful way where you do 2 antibody testing to increase your sensitivity and specificity into the 99+% range, because we think it's really important that you have a very high quality test, but a high quality test that you can really tell someone that they've had this before. And so we're waiting to have those 2 tests that we can do in series to really assure people. But that was in the guidelines from the very beginning, and we think it's fundamental both for right now and going through the fall, because that will be our early alert if any of the COVID virus reappears.
How much more testing are we
John,
going to
you
need?
didn't know that was in the guidelines?
The CDC
Well,
criteria
it's
says
currently in the
that.
CDC guidelines, so you're
It's
saying...
right, but it's right in the guidelines.
Dr.
Surprised
Burks,
at you.
while you're there, can I
Jerome, would
just,
you like to say something in that, please?
Thank you, Mr. President. And I just want to reiterate to everyone that the task force and the administration have a commitment to protecting vulnerable people. And that includes in the area of testing. We've had the opportunity to talk to many different groups, and we hear that testing is absolutely a concern. And we'll be giving you more details in the coming days, but I just want you to know that we're building on the public-private partnership that the President rolled out with pharmacy and retail companies like CVS, Walgreens, Rite Aid, Walmart, and Kroger to accelerate testing for more Americans in more communities across the nation. We're going to be increasing access to testing for undertested, underserved, and minority communities, and we're working closely with partners and states to establish sites in areas most in need of increased access to testing. We're using data. CDC provided data to locate sites in counties that are undertested and socially vulnerable especially with high populations of Black, Hispanic, rural, and Native Americans. We're using the CDC's vulnerability index, as you heard about earlier, to select sites. This measures the resilience of communities when confronted by external stressors along 4 main themes: socioeconomic status, household composition, and disability, minority status, and housing type. Our goal is to have about 2/3 of these initial sites located in counties with moderate to high social vulnerability, and about 1/4 of these sites in counties with high social vulnerability. So again, I want communities that are vulnerable to understand that we are strategically and intentionally making sure we're deploying testing in those areas so that people can get identified if they have symptoms, can get identified if they are asymptomatic, and that we will be able to deploy resources appropriately.
Thank you, President Trump. If possible, I'd like to ask a question to Dr. Fauci and then a very different one to you. To Dr. Fauci, today the CDC and the USDA said that the first pets in America had tested positive for the coronavirus. What does that mean, and what should the public know about that?
Pets?
Pets, 2 pets.
So that question was asked before, but I'll be happy to answer it again. Certainly, animals, pets, can get infected. Big cats in zoos have been reported to be infected with coronavirus. There's no evidence that the virus is transmitted from a pet to a human. Now, obviously, is that impossible? I mean, biologically, anything is possible, but there's no evidence whatsoever that we've seen from an epidemiological standpoint that pets can be transmitters within the household. So it's not surprising. I mean, when you have viruses that can infect multiple species, isolating it from an animal doesn't necessarily mean the animal is transmitting it.
What about the lion in the New York Zoo?
Yeah, well, that's the lion in the New York.
How did that happen?
It probably happened. I don't know, Mr. President, but I would imagine that one of the zookeepers probably had an asymptomatic infection, took care of the animal, gave him some food, touched him or whatever, and that's how we got it.
People are wearing face masks now that the federal government advised it. It was almost overnight, but less than a month ago, our Surgeon General said that, and I'm quoting, they're, quote, not effective in preventing the general public from catching coronavirus. I mean, should there be accountability there, and also for the HHS Secretary?
Well, I don't know. Would anybody like to speak about it? I think, just so you understand, if somebody wants to wear them, I'm all for it. Would somebody like to discuss that?
Go for it, boss.
I think the comments that we made when we came into face masks, and I think it's important when we came out with the CDC guidance about face masks, or what we called face coverings, was in recognition of the growing understanding of asymptomatic infection or pre-symptomatic infection, was the recognition that we could use a barrier. And the reason, and I have mine when I'm in public right here that I use, that this barrier, in case I was in fact infected, if I didn't know, is a barrier to prevent me to protect you in case I happen to be asymptomatically infected. There's very good data to show that the ability of viral particles to go through a barrier is substantially diminished. And that's why we recommended these face coverings. I think if you go back to when CDC came out with that recommendation, some people may think intuitively it's to protect them from getting infected. No, it was to protect you from potentially getting infected by me when I go out in public. Jerome, do you?
I actually appreciate you asking that question because it's one that that we've had to clarify several times, and I understand why the American public has been confused over time. As Dr. Redfield mentioned, initially we said, based on CDC, World Health Organization, and most other major public health organizations, that the public needed to know that these masks were not effective or shown to be effective in preventing you, if you wear a mask, from catching coronavirus. Another important thing to remember is the context of those statements was a run on medical masks, on N95 masks, and our healthcare workers were at risk. What's changed? What's changed is we found out that unlike past viruses that are spread through the respiratory route, a significant proportion of coronavirus cases can be traced back to asymptomatic spread. So The task force deliberated this. We've always told you that we will look at the facts and we will give people recommendations based on the best available evidence at the time. And once we saw that asymptomatic spread, we said, well, masks still aren't effective, and from our point of view, at preventing you from catching coronavirus in a significant way. But we've always told people that they should wear masks if they know they have symptoms to prevent them from spreading to other people. Well, now that we know about 25 to 50% of people are spreading asymptomatically, we suggested people wear cloth facial coverings to prevent asymptomatic spread. You wear your mask to protect me. I wear my mask, and Dr. Redfield mentioned it. I've got my mask. I believe I have mine on me, Bob. I carry mine around with me, too. I wear my mask to protect you. We're 6 feet away, which is why I'm not wearing my mask to protect you now, and we also all have been tested. So that's why I'm not wearing mine now.
Yeah, but I'm right next to you.
Well, I'll put mine on if you want me to, sir. But again, important to know that if you're going to wear a mask, it's not a substitute for social distancing. Still, social distancing is the #1 thing you can do. Number 2, it's important to know that you should practice good hand hygiene and not touch your face, because you still could touch a surface and bring disease to your face. And number 3, this is the most important, well, it's just as important. Please, save the medical mask, the N95s, for the healthcare workers, because the cloth facial coverings are effective, as far as we know right now, based on the best available evidence, at preventing you from spreading disease to other people. So no inconsistency there. It's just the recommendation changed because the information changed, and that's what you want from your public health leaders.
And the argument made that you knew about asymptomatic transmission at the time that you said that, and that you were essentially misleading the public so that they
Well, I mean, the honest answer to you is no, we did not. That was the recommendation of the World Health Organization and the CDC, and we gave you the best information we could at the time. So I actually a little bit resent that implication, because I work hard to try to protect the American people, and we are always going to give the American people the best information we have available at the time. And we're humble enough to say, look, if we don't know, we're going to change.
Yeah.
I just had a follow-up question for Dr. Fauci, if you don't mind.
Yeah, sure.
I'm happy to ask you one after. So John had asked the president about Rick Bright, and he said he wasn't sure who that was, but I'm sure you're familiar who he is, since he was the head of BARDA. So there's a concern or an accusation he's raised that he was removed from his job because he protested widespread use of hydroxychloroquine. Are you familiar with this situation? And do you feel like public health experts feel they are able to speak publicly or to speak out in opposition to things? Yeah. So you don't feel like there's any concern among people at the NIH right now or in the public health community?
At the NIH? Absolutely not.
Dr. Fauci, knowing Dr. Bright and knowing what his gifts are as one of the country's leading experts on vaccines, are those gifts best suited at NIH rather than BARDA? What's he going to be doing with you?
What is he going to be doing at the NIH?
So first of all, are his gifts best suited to work with you rather than BARDA?
I don't really think I can comment on somebody's relative gifts. I mean, he's going to be at the NIH and he's going to be responsible. From what I hear, again, this is what I've heard, that he's going to be responsible for the development of diagnostics, which is very, very important. The NIH is going to be involved in trying to develop new generation diagnostics, which we feel is going to be very important for the future of being able to facilitate the kinds of things that now are sometimes problematic.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用呢？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗、更多的政府席位。想要给自己发声啊，赶紧上网填，打电话也行。
请上2020census.gov 完成普查。